Good morning, good afternoon, and good evening to everybody who's participating at this webinar. I understand we have people from all the different continents. So today we are going to do a webinar on what is new in the treatment of autism, cerebral palsy, muscular dystrophy, and other neurological disorders. And our focus is going to be on a new form of therapy that is called stem cell therapy and certain other integrative therapies. I'm Dr. Alok Sharma. I am a neurosurgeon and I'm director of the NeuroGen Brain and Spine Institute, as well as professor and head of department at the Lokmanya Tilak Municipal Medical College. So why are we all here? We are here for this webinar because we all have special needs children, children who have neurodevelopmental disorders such as autism, cerebral palsy, intellectual disability, maybe advanced learning disabilities, etc. And what has happened is that, you have been told that there is no cure for the condition. You have been told that there are no medicines. You've been told that there is no surgery possible, and the only option that you have is rehabilitation. This is what you've been told so far. And I'm here to tell you that this is no longer true, that medical science and recent advances in biotechnological research have brought about very simple and very safe solutions that can help our children. So the older thinking was that once the nervous system is damaged, it does not regenerate. This has been the thinking for over 150 years of modern medical practice. But this is not true anymore. Now what we know is that some amount of regeneration is possible by cellular replacement and repair. So this is what has changed. The old thinking, if the brain is damaged, nothing can be done. And the new thinking is, we can do something. So this is what is happening right now. Now look at the picture on the left. This is an X-ray of a fracture of the leg. And you can see the bones, both the bones of the legs are broken. You can see the fracture. And I ask you, if we or our children or anybody known to us had a fracture like this, would we give rehabilitation? Would we give physiotherapy on a broken bone? We would not, right? What would we do? We would go to an orthopedic surgeon, we would fix the fracture with plates and screws, and then we would give rehabilitation. Nobody does rehabilitation on damaged tissue, on damaged bone. But for the brain, this is what we have been doing so far. This is a scan of a child with autism where the blue area is the damaged part, and we are giving rehabilitation on damaged brain. Obviously, we will not get the results that we want because the brain is damaged and we are giving rehabilitation on damaged brain. Just like if we gave rehabilitation on a broken bone, it would not work. Now, what if we could regenerate this? You can see here the green, this is regenerated brain. You can see this, the blue damage, you can see. And then we gave rehabilitation on a repaired brain. Would we or would we not get better results? And today in this webinar, I'm going to show you how it is possible through very simple and very safe treatments to repair the damaged brain and then give rehabilitation. So we operate out of two hospitals. We have two hospitals. Both are located in the city of Navi Mumbai, India. And, in one facility, we have all our stem cell and rehab. And then we have integrative therapies. We have so far treated over 10,000 patients from 70 different countries across all the 6 continents of the planet. So we have people from all over coming to us for therapy. And we have all our work is published in scientific journals. In the medical world, your work is credible only if it has been peer reviewed. The work peer reviewed means somebody has evaluated our data, has studied our data, and found it to be worthy of publication in a scientific journal. So all our work, all our results are in the public domain. They have been peer reviewed by different journals, the editors of journals and independent reviewers, and over 100 scientific papers have been published, of which 16 are on autism, 15 on cerebral palsy, 18 on muscular dystrophy, etc. So this is very important. So wherever you go for stem cell therapy, your country or any other country in the world, it is important that you ask the treating doctors if their work is published in scientific journals. We also have published 16 different books. We have books written for doctors, we have books written for therapists, and we also have books written for parents. We have a parent guide for autism, a parent guide for cerebral palsy, a parent and patient guide for muscular dystrophy. And all these books are available free of cost. They can be downloaded from our website at no cost at all. And they are very useful in the overall understanding of how to look after special needs children. So cell therapy, which I'm going to focus about, shifts us from a state of hopelessness to one of hope. So what exactly are these stem cells? The word stem comes from the stem of a tree. And just like from the stem of a tree, you get branches and leaves and flowers and fruits, etc. There are some cells in the body which can become any cell of the body. A cell which can become a brain cell or a heart cell or a muscle cell, that cell is called a stem cell. How do these stem cells work? So the first ability of stem cells is that they can multiply. So if you have a single stem cell, you can make thousands or even millions of stem cells from that. This property is not available in the regular cells of our body. They don't multiply. So stem cells multiply. The second most important quality, and this is the quality that we use in our treatment, is the ability to convert into other cell types. So if you have a single stem cell, you can convert that into a brain cell or into a heart cell or into a muscle cell. So the same cell, the same stem cell, depending on where you put it. So if we put it into the brain, it becomes a brain cell. In cases of muscular dystrophy, put it into the muscle, it becomes a muscle cell. So this is the unique property of stem cells, that they convert into the cell that we want depending on where we put it, and then they multiply. Also, they release certain positive chemicals, and these positive chemicals are referred to as growth factors and cytokines, and these have a big healing effect on the brain. So this is another very useful property of stem cells, is that they release positive chemicals into the brain and the spinal cord. And the other property of stem cells is that they improve the blood supply. So whatever the blood supply before, when the stem cells go, they attract new and fresh blood towards the damaged portion. And this results in a better and enhanced reparative mechanism. There are different types of stem cells. You can get stem cells from the embryo, that is from, from the fetus, from abortion or from spare test tube baby embryos. These are called embryonic stem cells, but we don't use embryonic stem cells because these are dangerous. They have medical problems and there are ethical issues about it. So I wish to state that we do not use stem cells from the embryo. You also get stem cells from the umbilical cord. The umbilical cord is the cord that connects the mother and baby at birth. And nowadays, as you are aware, this cord can be preserved. So in case it has been preserved, then stem cells from there could possibly be used. But we don't use this either because the number of stem cells that you get in the umbilical cord is much less than that which we need to repair the brain. And also this has got certain preservatives in it, so we prefer not to use it. What we use is what is called adult stem cells. They are called adult stem cells, but they are also present in, in children. So this is in our bone. So if in our body, we have bones, and in the bone, in the center of the bone, there is a liquid called bone marrow. And this bone marrow has got a lot of stem cells. So we are able to get it from here. So we use adult stem cells. That means we take stem cells from the child itself and put it back in the child. We don't take anything from the embryonic stem cells, and umbilical cord stem cells are from the outside. These are from the child itself. And this induced pluripotent stem cells is still in the research stage where the external is adult and the internal is embryonic. It is not being used clinically so far. Now, the reason to explain this in some detail was that very often you hear negative things about stem cells. People to call it dangerous. They have various ethical issues. Now, all the negative things are about embryonic stem cells. There is nothing wrong or dangerous or non-ethical about cells taken from our own body and put into our own body. And because people confuse these two, there's a misunderstanding. So we do not use this, and we use adult stem cells. Now, the wonderful thing about stem cells, it's very easy to put inside because you can put it through a single needle prick. With a single needle prick, we can put it into the spinal fluid from where it goes to the brain. Or it can be injected intravenously or intra-articularly or directly into the muscles. So the way to put the stem cells back is through a needle prick. You do not require major surgery to put these stem cells back. So basically, stem cell therapy, what we do is we take healthy cells and replace damaged cells. Like this is the damage you see in autism. This is the PET scan of a child with autism. If we gave it stem cells, the damage would go away. So what's the scientific base for our therapy? You're all aware that the highest recognition in the field of medicine is an award called the Nobel Prize. And the Nobel Prize has been given 3 times, 1990, 2007, and 2012, to stem cell research. So in 15 years, 3 times, stem cell therapy has got the Nobel Prize. And the scientific basis of our work is the publication which I've already discussed with you. We also have, along with our scientific papers, now there are modern medical textbooks. And now this is a book on recent advances in autism. And they have introduced a chapter on stem cell therapy in autism. And they asked us to write this chapter. So now international textbooks, medical textbooks are introducing chapters on stem cell therapy. And when the editors look for who should write this chapter, they come to us. So we have written this chapter in this book on cerebral palsy, Challenges for the Future, published by Intech, which is a European publication. They've introduced a chapter, Stem Cell Therapy for Cerebral Palsy, which again, we have written. They invited us to write it. In this book on physical disabilities, therapeutic implications in STEM, there was a chapter, Stem Cell Therapy in Pediatric Neurological Disabilities. Again, we have written this chapter. In this book on muscular dystrophy by Avid Science, again, we have written this particular chapter on stem cell therapy in muscular dystrophy. So medical textbooks are now introducing stem cell therapy as a chapter. And most often they ask us to write because we have the world's largest experience and the largest number of scientific papers. In India, at the highest level, we have there is support for this treatment. Our Prime Minister, Honorable Shri Narendra Modi, when he went to Japan, he actually visited the stem cell therapy Institute of Professor Yamanaka, who won the Nobel Prize. In India also, whenever possible, it's possible, he visits stem cell facilities. I'm very fortunate that in one of the books that I have written, the introduction of the book was written by Prime Minister Shri Narendra Modi. And this is me presenting him a copy of that book. And this is the introduction. You can see this is the introduction that he's written for a book of mine. And what follows is a very passionate speech the Honorable Prime Minister made in Parliament regarding stem cells.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट या कमा को मिल गया, मैं इसलिए किया गया तो उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल के द्वारा युवा साइंटिस्ट कुछ खोज करें।
So it's very rare to have people like prime ministers and presidents talk about any medical topic, and here you can see our prime minister talk in the parliament about stem cells. So that was just to give you a background because many of you have not have heard of stem cells. Now let's get back to really what exactly this is about. So how is this treatment done? That's the beauty of the treatment. It's very, very simple. So all that is required is 2 needle pricks. With 1 needle, we put a needle into the bone just above the hip bone. It's called the pelvic bone. You can see this picture. There's a needle that goes here. This is a real picture. And we aspirate with a syringe, the liquid inside the bone. This takes about 15-20 minutes. Once we have taken out the bone marrow, we take the bone marrow to a laboratory where we filter it and separate out the stem cells. And this takes about 4 to 5 hours. And then with a very thin needle, we inject the stem cells into the spinal fluid, and then the spinal fluid takes it to the brain. So let's watch a video of how this is done. So you saw that. I'll just do it again. So here is the bone marrow coming out. You can see this. I'll just do. Again, you can see the child is sleeping and this is the bone marrow coming out. Then we take it to the laboratory. Here the stem cells are separated. And then through a very thin needle, it is injected back. So you can see just 2 needle pricks. With 1 we take out, with 1 we put. And what are we putting into the child? The child's own filtered cells. There is nothing artificial. There is nothing from the outside. We are using a child's own good, healthy cells to go into the brain and repair the damage. So this is just a repeat of that. So now let's look at autism very briefly. We'll run through. Before we get into stem cells for autism, we must understand what is autism and what are the standard treatments and what is new. So we know it was actually described in 1943 and it is normally diagnosed in the first 3 to 4 years of life. It is classified now not as autism but as autism spectrum disorder, and it could be mild, moderate or severe. Boys have it 4 times more than girls. Now, what is happening is there's a tremendous increase in the incidence of autism. So in 2004, it was 1 in 166, whereas in 2018, it went to 1 in 53. And in 2021, it has actually come to somewhere about 1 in 50. So there is a dramatic increase in the incidence of autism, which means that almost 70 million people on the planet have autism. That's 1% of the world's population. 1% of the world's population has autism. So to all our families who are listening to this, you're not alone. You are not alone, because when our child has autism, we tend to feel very alone. We feel, that, we are just suffering by ourselves. Yes, our suffering is unique, but there are 70 million families there going through exactly what you're going through. So the main symptoms in autism, you're all aware, is problems with communication, problems with social interaction, education, and restricted or repetitive behavior. A question that parents often ask myself is, why did my child develop autism? And we'll quickly look at some of the causes of autism. So there are different causes. There can be problem during the birth process, problem with the intestine, exposure to toxic elements, and the use of electromagnetic radiation. So there is increasing focus on the mother's physical and emotional health as well. So far, the focus was only on physical health. So if a mother developed an infection, any viral infections or diabetes or polycystic ovarian disease, that predisposed the mother to having a child with autism. But what we are increasingly finding is that emotional stress, depression during pregnancy is also one of the important causes. So the mother's physical as well as emotional health is very, very important to prevent children from having autism. Smoking in mothers is also one other cause. Now, the older age of the father is a very important cause as well. So a father who has a child at 45 years has a 3.5 times more risk of having a child with autism than a father at 24. Then children with intestinal problems, have a connection. 9 out of 10 kids with autism actually have various abnormalities in the gut, particularly an imbalance between the good bacteria and the bad bacteria. And this has a lot to do, of course, also with the fact that our children, earlier children were being breastfed. It is recommended to only breastfeed mother's milk till 6 months. But nowadays we are noticing that children are put on other feeds much earlier, and there's a faster use of junk food and other non-healthy food, which disrupts the child's gut, because the child's gut is not able to process food except from simple food and mother's milk in the first few months. Now, this is another important cause that most people are not aware of, that the use of that radiation from the mobile phone. So all our mobile phones, they transmit a certain radiation. And if a pregnant mother uses the mobile phone a lot, that radiation can actually damage the child's brain. And this is something which is, not... they can't hear us or what?
No, questions.
But can they?
They can hear. They have submitted questions here. We have started already raising questions.
No. Okay, sorry. We just go ahead. So, and how do mobile phone cause damage? This is also known. For example, our brain has got something called a blood-brain barrier, which is like a security guard between the brain and what is in the blood. So the brain is the only organ in the body. The heart doesn't have it, the liver doesn't have it, the kidneys don't have it. Only the brain has got a security guard called the blood-brain barrier. And and what happens is the radiation from mobile phones actually damages that. And so what happens is, unhealthy things from the blood can actually enter the brain of the child. So excessive use of radiation of mobile phones during pregnancy is one important cause. Then there are other things like lead poisoning, for example. And where do you get this lead? A research from India, from an Australian university, actually showed very high levels of lead in kids with various intellectual disabilities in India. And where do these come from? They come from various things in the environment. But in particular in India, they found that one of the most popular brands of noodles, that 90% of the kids have had very high levels of lead. So we have to be careful of the food that we give our children. Mercury is another, and aluminum is another. So heavy metals in the body can also cause autism. Then, of course, the very controversial area of vaccines. So in 1998, Dr. Wakefield actually, proposed that the preservatives in the vaccines could possibly be causing autism, but there was a lot of criticism of his work. And later, there have been 25 other articles that show that this is not really true. And a lot of parents do say that it was after vaccination that the child regressed. There's no final conclusion on this, but as medical doctors, we advise parents, please immunize your child, give them vaccines, because the danger of not giving vaccines is much more than the danger of giving vaccines. So the management of autism is multidisciplinary. There is no single bullet. There's no silver bullet. What we want very often is one thing. We want to do something, autism disappear. Unfortunately, that's not so. We will require multiple interventions. So we already have various forms of rehab, and they're all listed here: applied behavioral rehab, speech therapy, occupational therapy, physical therapy, etc. And there are various other newer treatments, biomedical treatments, neurofeedback, hyperbaric oxygen, and stem cell therapy is one more addition, and it all works together. The point I want to make is stem cell therapy does not work in isolation. You will still need to do rehab after the stem cell therapy. So let's just very briefly, this is something you're familiar with, so I'll run through it. So I mentioned this for emphasis, that comprehensive rehab is an integral part of the results we get in stem cell therapy. And I like, if you can compare the brain to a computer's got hardware and it's got software. Right? A computer's got hardware and software. Likewise, our brain also has hardware and software. Stem cell therapy corrects the hardware. The software comes from rehab. So rehab is very, very important. And among the rehabs, there is applied behavioral analysis, there is occupational therapy, there is sensory integration, and this is the sensory integration room at our hospital. There is speech therapy, there is physiotherapy. So in autism, a lot of people believe that there is no role of physiotherapy, but we found that physiotherapy has an important role to play because these kids do have certain physical issues as well. Aquatic therapy is something we believe a lot in because we found tremendous benefit of aquatic therapy. Aquatic therapy is not swimming. Aquatic therapy is rehabilitation in water, and it requires specially skilled therapists. And aquatic therapy is an integral part of our program, and we find it very, very useful. Then there are various art-based therapies, music therapy, drama therapy, etc. So that was rehab. We also have what is called integrative therapy. So at our institute in NeuroGen, we combine stem cell therapy with rehabilitation with integrative therapies. So we have three things: stem cell therapy, all the neuro rehab that you saw, and integrative therapies that I'm going to speak to you about. What are these integrative therapies? So one of them is hyperbaric oxygen, HBOT, that you're all familiar with. This is the HBOT machine at our hospital. And basically what happens with hyperbaric oxygen is that, and there you can see in our machine, the child goes in with the parent. They are very comfortable. They could sleep there, or there's a television program. Most of the kids love to watch cartoons in it. And, it's very comfortable. There are no problems with the hyperbaric. And how does hyperbaric oxygen work? So this is what explains. Normally, this is a blood vessel, and in our blood, we have red blood cells and white blood cells, and the liquid in the blood, which is called plasma. So what is the blood made of? Red blood cells, white blood cells, and plasma. Now at normal pressure, only the red blood cells carry oxygen. I repeat, only the red blood cells, and in the red blood cells, the hemoglobin. So the hemoglobin is the only thing that takes oxygen from our lungs, from our heart to different parts of the body, including the brain. But when you give oxygen under pressure in a hyperbaric chamber, the entire plasma, the entire liquid starts carrying oxygen. So much more oxygen goes into the brain and into the whole body. So we find this a very useful part of integrative therapies. So the brain gets increased blood oxygen through hyperbaric. So it also improves the immunity, stimulates oxygenation, improves metabolism, increases energy levels, reduces fatigue, and improves the overall functioning. Then there's another therapy called ozone therapy. So oxygen is O2 and ozone is O3. It's like an activated oxygen, which apart from killing all kinds of infections, reduces inflammation and swelling, and has a very strong antioxidant and a beneficial effect on the brain. So this increasing of oxygenation and improving the immune system, reducing the inflammation and detoxification has a very beneficial effect. So along with our stem cell rehab, we also have hyperbaric oxygen and ozone therapy. And it's very easy to give. You can breathe it through a tube. This is how the ozone is made. It can be breathed through the tube. There is a chamber. It can also be given through different ways, like through the ears, for rectum, etc. Now, since a lot of kids have gut issues, we have a gut cleansing program. So in the children with autism, there's an imbalance between the good and bad bacteria. And by gut cleansing, we find that we can improve the gut health. Then, so that's then we have different treatments like infrared. This is especially for children with cerebral palsy and muscular dystrophy, where we go in and relax the muscles. Then there's acupressure, and these are all the integrative therapies. Then we use high dose vitamins and micronutrients, so we supplement all the deficiencies, because we are finding increasingly that a lot of our kids, especially with autism, have low vitamin D levels, low vitamin B complex levels. And so we supplement all this, sometimes through injections and sometimes through tablets. So the treatment at our institute is multidisciplinary. All these things are done together. So what is new now? I mean, what is new? What is new is our understanding of autism, that what's going on. What is new is stem cell therapy for autism. So here is a scan of the brain, and this is called a PET-CT scan. And the blue part here is the part of the brain that is weaker, partially damaged, functioning less, partially inactive. And we have in over 3,000 patients found that every child with autism has this kind of damage. We've seen the same thing in cerebral palsy, intellectual disability, etc. So this is something which was not known before. This is our original research. And we've published this in a very prestigious journal, the World Journal of Nuclear Medicine, where we have published for the first time exactly which parts of the brain are damaged. So, and what happens is that the areas of the brain which are damaged, they correlate with the symptoms. So for the first time when you come to us, you will see through the scans of your children, why our children are not talking, why our children are hyperactive, why they have all the problems that they have, because there is a part of their brain that's not functioning properly. And even as non-medical people, you can make out the color blue from the other color. So whatever is blue on the scan is damaged brain. And so this is work which is published. Now, what we found was something very interesting through our research. We found that in normal children have no damage. And in normal children, this is the brain function. The higher it is, the better. This is the age. So you see, this is 0 to 5 years, 10 years, 15 years. So normal children, the blue is normal children. The brain function with age keeps on increasing. But in children with autism, the brain function keeps on decreasing. This was not known before. So why is this important? It's important because the earlier you treat your child, the less gap you have to fill. See, we want our children's brain to become normal, right? So if you treat at 15 years, you have to bridge this gap. But if you treat at 5 years, you have to bridge this gap. So if this is easier than this, therefore, the importance of early intervention. The earlier we intervene, the better results we are likely to get, because the brain functioning in children with autism keeps on decreasing over time. So these are our results. Now we've treated over 3,000 patients, but this is data from 700, where 33% of our kids have a significant improvement, which means they are no more on the autism spectrum. I'm going to repeat that. 1/3 of our children are no more on the autism spectrum. The autism has been reversed. All right. They are going to normal schools. They don't need any further therapy. But that's 1/3 of our children. About 30% of our children have a moderate improvement. That means they've had improvements, they are independent, but they still are not off the spectrum. They still have certain issues. 25% have a mild improvement. That means they have improvement in some symptoms, but and they are still dependent. And about 10% of our patients do not improve at all. So we have approximately 89, roughly a 90% success rate. But what we found is very interesting. We found that all these children were below 10, 11 years old. They were all actually before puberty. Puberty is the time when a boy becomes a man or a girl starts having menses. So when you treat children before 10, there's a chance of their being off the spectrum. Those between 10 and 20 had a mild to moderate improvement. And all the kids who did not improve were over 20 years. So what this clearly shows is that the earlier we treat our child, the better it is. And this is not just true of autism, it's true of everything. You know, in cancer, for example, if you diagnose your cancer, you treat it, you can be cured. The same person, if you diagnose late, you cannot cure. It's true of diabetes, it's true of hypertension, it's true of any disease. That the earlier you treat, the better control you get. So our results very clearly show that it is better to treat the children before 10. Of course, if you treat later, you will still get improvements, but the improvements will be lesser. And this is to show you what is called statistical analysis, because when I say that our children improve, we have to show statistical improvement. And these are various scores, and this is the average before and the average after. And we have to show through a statistical evaluation that this is significant. But these are the most important slides of my talk. On top is the slide of the same child. These are different sections, horizontal, vertical, and lateral. And the blue is the damage. This is the damage. This is before stem cells. And after stem cells, you can see that the damage is much reduced. So you can see the damage before, and you can see that afterwards the damage is gone. All right. So we don't have one or two. I'm going to show you 2, 3, but we have 3,000 such scans which show damage before and damage after, and resolution of the damage after. This is objective proof that autism can be reversed, that the brain damage in children with autism can be reversed. Here again, you can see the blue, which is the damage, and you can see after stem cell below, it is gone. Here again, you can see the damage that is blue. This is a child of autism who had, cortical venous visual problems also, and you can see that it is gone. And so some people ask us, but how do you know that this, this is a continuous damage? How do you know after a few years, the damage will not come back? So in a few parents, we studied year after. So you can see in 2012, the damage, it became less in 13, and 14, it still became less. So we've actually shown that the improvement is progressive and sustained. Once the damage is gone, it never comes back. It continues to improve. Now, our work is published in a prestigious journal, Stem Cell International, and the world's first scientific paper on stem cell therapy in autism is published from India. It is published by us. So we hold the distinction of publishing the world's first scientific paper on stem cell therapy in autism. And this is our paper. The second paper came from China. The third paper was from Italy. And the fourth and fifth papers have come from America, from Duke University. So this is important because we led the way in this. We showed the world it is possible to treat autism through cell therapy. And now the other countries, including America, they're showing similar kind of results. We have a total, apart from that world's first paper, we have 16 other papers as well. Now, just to show you a couple of videos, and we have 5 children from 5 different continents. But for want of time, I won't show you all of them. We will just say maybe see 1 or 2. So the first one is a child from the United States, and his parents, father was a doctor, mother is a nurse. And let us see what kind of improvement he had.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just fell backwards.
He would flap like that. And he would walk on his tiptoes, look at the wall, and be talking to the wall. If he had problems with eye contact, he'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. The big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely different in his engagement with us, with his siblings, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh had gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
You can see he's getting all A+. So here was this child, studying in a special school, having very poor, almost little speech. And as you saw in the video, In 5 months, he went from a 3rd grade reading level to a 7th month. Today, this child is in a normal school, and as you saw his report card, he's getting A pluses, a GPA of 3.82. And recently I spoke to his father, and he said for the first time in the history of that school, it's a 100-year-old school, Ganesh got full marks in Spanish. No child has ever got full marks in Spanish, but he actually got. A child who could not speak is today topping his class after stem cell therapy and getting full marks in Spanish. So that's the miracle. That's the miracle of stem cells. So this is another child who underwent stem cell therapy. You know, it's from India, and you can.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me, and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade.
He passed his 10th grade in school, and today he's in college.
There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions on other special kids.
He's now taking tuitions for other special kids. So this is amazing. This child who was completely hyperactive, poor speech concentration, is today improved so much. He has passed his school, 10th standard. He's now studying in college. And most important, this child is taking tuitions. He's teaching deaf children. And that's amazing. A special needs child is today teaching other special needs children. So that again is the miracle of stem cells. So we have a couple of other videos, but I'll just go ahead for want of time. We'll quickly run through in the next couple of minutes some of the other conditions. There is cerebral palsy, in which there is damage to the brain, but unlike autism, where there is a problem with the higher functions. In autism, you have a problem with speech, behavior. In cerebral palsy, because of brain damage, the problem is in the body. There is tightness, stiffness of the hands and legs called spasticity. There is weakness. There's an inability to walk and use hands. And very often these children are wheelchair bound. There are different types of spasticity depending on where the brain damage is. And these are our results. And you can see that 20% we have a significant improvement. That means they are back to normal. 41% have a moderate improvement. That means they become independent. 30% have a mild improvement. 9% don't improve. But in cerebral palsy, there is no age correlation. In autism, there was a correlation with age. The younger the child, the better the improvements. In cerebral palsy, the improvement is based more on the severity. The less severe the damage, the more likely better the improvement. Now here you can see the objective improvement. The above is the scan. The blue you can see in cerebral palsy, the damage is more extensive. And below you can see that the damage has reduced significantly. Here again, on the left-hand side, the blue is the damage. And after stem cell therapy, you can see that it's almost completely gone. This is objective proof that the damage in cerebral palsy can also be repaired with stem cell therapy and improvements with neurorehab. So again, our work is published in the journal, a clinical study of bone marrow cells in cerebral palsy. It's not the world's first paper. Autism was the world's first paper, but all our work is published, and we have several other articles as well. So all these are papers on cerebral palsy, stem cells in cerebral palsy. Now let's look at this video. This is a child from Kenya, and he was completely wheelchair bound, unable to stand, use his hands. And here you can see the improvements, the tremendous improvements he had. 14-year-old boy, spastic quadriplegic, unable to sit, stand, walk, totally wheelchair bound. And now you can see after the treatment on the right, he can now wear his own shirt, he can remove his clothes. This was impossible before. He's able to pack his bag, He's got, he's using his hands. He can stand. Earlier, he could not even stand up. Now, not only can he stand up, he actually removed a bottle and he can drink himself. So this is something so important to the parents, that the child who was totally wheelchair bound, and here you can see he's now walking by himself. All right. So this is again the magic and miracle of stem cells. A totally wheelchair bound child who could not use his hands, who could not even stand, is today walking and is in a position that he can stand up, open the refrigerator, take out a bottle of water and drink. And this has happened because of stem cells. Then we have muscular dystrophy, where the problem is not in the brain, but it is in the muscles, and the muscles become weaker. And as you can see, this, at 5 years, the gray is normal muscle. And you can see over the years, the gray keeps reducing. And by the time they're 16, it's all white, it's fat. In the most common type of this Duchenne muscular dystrophy, all the children die in their early 20s. By their 20s, and they all die. There's a 100% death rate, 100%. And after our treatment, our patients are living way beyond this, and we're able to save the lives of these children through stem cell therapy. And those are our results. You can see that we have an 85% success rate. The ones that have a significant improvement is much less. It's 4.5, 35% moderate, 20% mild, 14% remain the same. They don't improve, but they don't worsen. But what you must understand is without stem cells, all of these would have deteriorated and died. I repeat, all of them would have deteriorated and died. But out of them, 4.5% have significant improvement and 14% are remaining stable. They're not worsening. So that's an 85% success rate. And this is a comparative study we did with treated versus untreated patients. So patients treated with stem cells, they stabilized like this. And those patients who did not get stem cells continue to deteriorate. So this is called a comparative study, which clearly shows the huge difference between those who received stem cells and those who did not receive stem cells, who continue to deteriorate and die. And this is objective proof. Above is a scan where the white you can see is, fat. There is no muscle. And after treatment, you can see it's become black. That means muscle has come back. Here again, you can see that this is an EMG, which shows a very weak contraction. After stem cells, the contraction is very powerful. And we have 18 scientific papers. And here's a video of this child from California. He had not stood for 2 years. He could barely crawl. He was totally unable to walk. And let us see the amazing improvements. So before, you can see he can just crawl. He could not even stand. For 2 years before coming to us, he had not stood. And after stem cell therapy treatment, he started standing. Earlier standing with support, and then started walking, first with the walker. Then gradually the walking improved to the point that he started walking with lesser support, with a parallel bar. Now this looks little, but you have to understand, this child could not even stand before, forget walking. And now he can walk indoors. And soon you can see he's able to walk outdoors. And President Obama, President of the United States, heard about his improvement and invited him to the White House. So, Sohail actually got to meet with President Obama, who heard about his improvements. And that was Sohail from there. And then intellectual disability. Earlier, this was referred to as mental retardation. Now we don't use that word. We call it intellectual disability. Here, the damages are for different type. And these are our results. 84% of our patients improve, 20% significantly, 13% don't improve. And all aspects, their problem solving, social inhibition, understanding of relationships, toilet training, memory, all these things improve. And here is the scan. Above the blue is the damage. You can see this is before the stem cells. And after the stem cells, you can see that the damage has disappeared. So this is objective proof that stem cell therapy can help in intellectual disability. And the world's first scientific paper, again, is on intellectual disability and stem cells, is published by us. This is that paper. And then we have 3 other papers. Then there is a spinal cord injury. This is people who have a fracture of the spine and they cannot use both their lower legs or sometimes the hands and legs as well. And these are results in over 1,000 patients, 24% significant improvement, 4% patients do not improve. And all our work is published in international journals. This is our detailed analysis in thoracic spine injury. And we have several other papers as well. And here is this video of this. He was a soldier from the Indian Army. He was shot by terrorists. And he was totally paralyzed. He could not even sit. He was totally bedridden when he came to us. And after the treatment, first he developed standing, then he could, start moving from the ground to above, and then slowly could transfer. And when he came to us, the only thing he asked me, he said, "Doc, make me good enough so I can get a gun in my hand and go back to active duty and kill more terrorists." And we kept our promise. Not only did he, after stem cell, you can see he's walking now, but he was honored by the highest award. It's called the Shaurya Chakra at the hand of the President of India. We got a gun back in his hand. He actually won a bronze medal in the National Shooting Championships, and he joined active duty in the army. So a soldier who was totally paralyzed not only improved that he started walking, but he won a shooting championship. And it's very rare. The army normally does not take back people who have paralyzed, but he became good enough to join back duty. So brain stroke, this is when one half of the brain either has decreased blood supply or a hemorrhage. And these are our results. You can see 50% have a very good improvement. And this is a scan. You see the damage above, you can see the damage, and below you can see the damage is resolved. You can see this is the speech area, and you can see that the damage there is gone. So there is objective proof that even in brain stroke, those who are paralyzed on one side, those who have no speech, they also improve. Again, all our work is published in scientific journals. Then in head injury, this is because of road traffic accidents, etc. People have a damage to the brain, they go into a vegetative state, and these are the results: 29% significant improvement, 5% don't improve. And here's a scan showing the damage to the brain before, and you can see afterwards the damage is gone totally. Again, our work is published in international journal, prestigious journal, Springer Plus, and these are other papers. So here's this. This is 3 years after his head injury. He was in a vegetative state. You could not communicate with him. You could not talk to him. He was in like a vegetative state, and then afterwards, you can see before he was, there was no way to communicate with him, and afterwards, you can see he started responding, and it's like you could deal with him, you could talk to him, you could communicate with him. And here he is before and afterwards. You can see that he is able to sit, he's able to do, he's got some activity with his hands. See there, the right hand is paralyzed. He is actually moving the right hand after stem cells. And, most important, he could feed. This was a very emotional moment for the mother when he could actually, eat by himself. A small, for somebody else, it may not matter, but for a mother, for the child to be able to eat herself was a very big thing. And now, most important today, from being in a vegetative coma, this child can actually use a mobile phone. So those are the kind of improvements that you can have after stem cell therapy. And the last is a disease called motor neuron disease. In America, it's called ALS. And this is a disease where 90% of the people die within the first 5 years. And we are able to save their lives with stem cell. We did a comparative study, which is published in the American Journal of Stem Cells, and we saw that the patients we treated, we were able to stabilize them and save their lives, whereas untreated patients continue to deteriorate. And like I said, this is a controlled study, and this is published in the American Journal of Stem Cells. the difference between treated and untreated patients. And we have several other papers on this as well. So a question that many of you may ask is, well, the results seem so good, but how safe is the treatment? Because that's a very, very important question. Are there any risks? Are there any complications? Are there any dangers? So here's the answer. The answer is good news. There are no major adverse events. We've treated 10,000 patients, and we've not had any patient who's deteriorated, has a major adverse event, side effect, or complication. But there are certain minor adverse events. For example, we found that 3% of the children who already had epilepsy, I repeat, children who already have epilepsy, in 3% of them, there can be a slight increase in epilepsy in the first 2 months after stem cell therapy, only in the first 2 months, not after that. But again, this is in children who have epilepsy. 10% of our children get a headache which lasts for 2 days after the stem cell, but after 2 days it becomes okay. Some other kids have a nausea, vomiting, some pain at the site of injection. So what is it? A minor adverse event is something which is treatable. So even if they have epilepsy, we can treat it with medicine, we can control it. The headache is self-limiting. It is there during your stay. It never comes when you go back. And nausea, vomiting is all during the stay. So these are minor, reversible, treatable, but no major adverse events. So the treatment is very, very safe. That's the beauty of this treatment, because there is no surgery. There we are not going in, there's nothing major, and we're using the child's own cells. We are putting nothing from the outside. This is the child's own cells. Our work has been recognized through various awards. This is a very prestigious award, the Rose of Paracelsus Award, from the Socrates Nomination Committee of the European Medical Association. It comes from Oxford in UK, and we were honored with this very prestigious award. We were also awarded by the European Society for Quality Research for best practices in 2018, and you get this award for pioneering and innovative research. We were nominated as the best stem cell therapy center in India at the National Healthcare Excellence Award in 2016. And in 2018, again, the Honorable Minister of State for Health awarded us with the best stem cell therapy institute and research center in India. So we heard the Prime Minister of India speak about stem cells. And the world's two biggest democracies are India and America. Now let's hear what the President of the United States, the earlier former president, had to say.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord that lifts someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So that was so the world's two biggest democracies, India and America. And you heard the Prime Minister of India talk about stem cells in Parliament, and you can hear the former President of the United States talk about stem cells. So obviously, this is not something small or new. When presidents and prime ministers talk about something, it is obviously something of larger public interest. To help you make your decision, you could visit our website, which is neurogenbsi.com, NEUROGEN BSI is for Brain and Spine Institute.com. You could send us an email, and we have a response time of less than 30 minutes. You will get a reply from a doctor. You don't get a reply from somebody administrative. A doctor will reply to you. You can WhatsApp chat, audio, video call us. You can have a Skype interview or a WhatsApp video interview. So a lot of people so all those people who are registered for this webinar, I'd like you to know that you're all entitled to a free video consultation with me. So please make use of this opportunity. That's the number there. You can, it's 9920-200-400. If it's from outside, you have to add +91. We repeat, +91 9920-200-400. You can send a request to this number, and at a time convenient to both of us, we could have a one-on-one personal consultation and that's completely free of cost. There is no charge to it at all. Because there are many things that you may not want to discuss publicly in a webinar. You're free to ask me questions after this. So to repeat, all those registered for this webinar are entitled to a free video consultation with me anytime over the next 2 weeks. And I could answer all your questions at a personal level. Now, once you have decided to, do the stem cell therapy, we appoint a specific coordinator. So there will be one person who will become your liaison, and they will help you for everything. How to get here, if from overseas, how to get a visa, for help you with the travel arrangements, inform you of the situation here, and we'll help you through the entire process till you arrive in NeuroGen. Now, I understand all of us are now concerned about the pandemic, but yes, of course, right now those from overseas can't come here. Those from India can travel. Just to let you know that yes, we are hearing a lot of things in the press, but Mumbai is very safe. We've reduced the COVID incidence is much less in Mumbai as compared to the rest of the country. We are actually in Navi Mumbai, which is a satellite city of Mumbai, where things are way much better. The COVID hospitals are half completely empty. There, the number of patients is much less, and we pick you up from the airport or the station or wherever you come from, and we bring you directly to the hospital. You are completely safe. Our hospital is completely, up to the most international and national standards of sanitization. Everybody's checked for, so it's completely COVID-free. So it's very safe to come for treatment now. In fact, it's better in many ways because, the number of people are a little less. So you get you always get personalized attention, but in these times, you get a little more personalized attention. For those of you coming from overseas, you will have to wait till travel restarts. And of course, the question in your mind will be, let's wait, but how long? I mean, this thing is not, it may take several months before everything completely settles. So all of you have to take a call. My suggestion is, if you can get to Mumbai airport, we take care of everything from there. All right, and you'll be completely safe and secure with us. Despite this, we are still continuing our treatments. The hospital is, is there. We are treating patients every week. People are still coming to us. So your coordinator will guide you through that whole process. What happens during your stay is you have to arrive on a Sunday. So you can arrive only on a Sunday, Saturday night to Sunday night. On Monday, is a day of evaluations. On Tuesday is the actual stem cell therapy. Wednesday to Saturday is rehabilitation and the integrative therapies, and you get discharged on Saturday. So this is a 1-week program. Some people like to extend this into a 2-week program, and you're welcome to do that as well. And your coordinator will discuss with you, because in case you want to have an extended rehab, but this 1 week is mandatory, and you could extend this to more if you want. So my conclusion is that stem cell therapy, the adult stem cell therapy, what we do is a safe and effective, and if you notice, I put safe before effective. It's a safe and effective treatment option for autism, for cerebral palsy, and for many other pediatric and other adult neurological conditions which cause paralysis, for which there are no other treatment options. So once again, this is just how you can reach us. You can contact us at NeuroGen BSI, contact@neurogenbsi.com, or +91 9920 200 400. You can WhatsApp us on that. With that, my webinar comes to an end, and I can see many questions. So I'm going to start answering the questions. So Gaurav Kodesia asks, heavy metals are presumed to be one of the causes of autistic behavior. Chelation such as ACC protocols, TRS, CDT are widely used in autism community. How do stem cells help in detoxifying heavy metals, or chelation is still needed after stem cell therapy? So that's a very important, interesting question. Now, what we have found, what you have to understand is that the heavy metals have done the damage to the brain that they had to do. The damage has already been done. It is done at the initial stage. What stem cells do is that they repair the damage. Okay, so chelation may take care of the heavy metals. Stem cell therapy does not do anything to the heavy metals. It repairs the damage caused by the heavy metals. But this question is very important. So we actually studied our data. We looked at the data of those people with heavy metals who had taken chelation and stem cell therapy, and those who had not taken chelation and stem cell therapy. We found the results to be the same because we are repairing the brain damage. So Gaurav, our advice is if the heavy metals are very high, the levels are extremely high, you could get the chelation done before the stem cell therapy. Stem cell therapy repairs the damage, but it will do nothing to the heavy metals. Now, anonymous attendee asks, if stem cells are taken from the bone marrow, then further there will be less for further. Okay, I think your question is, you are saying that if we take the bone marrow, later on the bone marrow will be less. No, not at all. The bone marrow is continuously made by the bone. So it's like, if we take, this water from here, this gets refilled. So the bone refills the bone marrow. And in a couple of days, the bone marrow is completely full, just a couple of days. So the answer to your question is it will not be less for later. The bone marrow gets replaced by the body immediately. Alok says, what will be the cost of stem cell treatment for autism for a 5.5-year-old girl and whether insurance covers it? Alok, as a general rule on a medical webinar, we do not discuss cost. But I understand cost is important. So what you need to do is to contact that number there, and somebody from there will send you the detailed costing. You get the entire costing on an email. But in a webinar, we normally, as a rule, medical doctors, all medical doctors, including myself, we don't discuss any aspect of cost in an informative lecture. But if you email us, you will get an instant reply. Sandeep Kapala says, is any test required before stem cell therapy for autism? What is whole exome sequencing testing? So when we require a lot of tests, we do a whole lot of blood tests. We do a PET CT scan of the brain. We do an MRI. We do an EEG. So we have a very exhaustive evaluation process. And all these are done once you come to the hospital. So you don't, everything will be done in the hospital itself. We will arrange it. And, we will organize for where it is to be done. Now, whole exome sequencing testing is not part of our protocol. So this is something to evaluate if there's a genetic, involvement in these children. We don't do that because that doesn't affect our treatment either way. So whether there is or it does not, our treatment remains the same. So we don't do it because we don't believe it is required. So Harish Babu says, please go ahead. Your voice is good. Thank you. Thank you, Harish. Now somebody anonymous says, I understand there's a risk involved to some extent for any treatment. What is the risk involved in this therapy? So I explained to you the only risk, and this is after doing 10,000 patients. This is the largest in the world. There is no other hospital in the world that has treated over 10,000 patients for neurological problems. There is no severe risk. The only risk, like I said, is that in those children who have epilepsy, the epilepsy can increase in the first 2 months after stem cells. That's the only risk involved. Autism is a wide umbrella term. Under what specific kids would you get more benefit from this therapy from your experience? So yes, autism spectrum is a wide term. And what we have found is not what specific kids, but the earlier the kids come, the better is the improvement. So autism spectrum, yes, it's very wide, and of course we find that there are different different symptomatology. You have children which have no speech to minimal speech to normal speech. You have kids who are very hyperactive to minimally hyperactive to being normally behaved. You have kids with great intelligence, high functioning to low functioning. But all of them benefit. The answer to your question is all kids benefit, but the younger kids benefit more. Okay, so that's the real answer to your question. The younger kids benefit more. What is the cost range? Like I explained earlier, we do not discuss cost on a webinar. So please, if you email us, you will get an email with about the cost. What is the age limit till which stem cell therapy can be done? So there is no age limit. The oldest child with autism I've treated is 38 years old, and he also showed some improvements. But the earlier you treat, the better it is. When we treat before 10 years, before puberty, those kids have a chance of going to a normal life. Once you treat after that, they don't get close to normal. They still have some residual symptoms of autism left. Then somebody anonymous says, Dr. Alok, thank you for well-explained presentation. You could clarify the points below. What is the best age to do stem cell therapy and get maximum benefit? So the best age is, the earlier we do it, the better. I mean, there is no best age. The earlier we do it, the better. So obviously, if you do it at 3 years, you get better results than if you do it at 6 years. If you do it at 6 years, you get better results than if you do it at 12 years. And if you do it at 12 years, you get better results than if you do it at 20 years. So the earlier, the better. What are the possible side effects? So the side effects, like I told you, no major side effects, but those kids who have epilepsy, the epilepsy can increase. How would we know whether stem cells will help the child? So yeah, of course, once you do the PET scan, in 6 months, you will see improvements. So our decision is made basically on the brain scans. We will see the type of damage in the brain scans, and we'll be able to guide you. Will the stems work? And also, not only will you see clinical improvements, but 6 months later, when we repeat the scan, you will actually see that the damage is gone. In case the stems are not working, would the child tend to lose his existing positives or strength? As is there a chance for condition to become worse? The answer to this is an absolute no. In case the stem cell does not work, as it does in 10% of our kids who are over 20 years, there is no losing existing positives or strengths. No child of ours, not a single child, has lost anything that he could already do after stem cells. Yes, 10%, especially those, the older kids, they did not improve. All kids below 20 showed some improvement, but nobody has become worse. Then another anonymous attendee says, if the child is on neurological medicine like Respadrol or Amplify, will it be taken off it? The answer to your question is no. We do not take off the child of any medications. You continue till you come to us. You have to continue all the medications. Once you come to us, we will decide. And you have to understand that this Respadrol is given for hyperactivity. As the symptoms improve, as the hyperactivity goes away, automatically the need for that will become less. But in some children, we may have to continue it for some time. So when you come to us, we will take all these decisions because they are not general; they are individual for each child. So in other words, in some kids we will take it off, in some kids we will reduce it, in some kids we will continue to give it as it is. After SCT, and the question is, he wouldn't need to continue it after SCT. So if once he improves, he doesn't have to do it. Now, Sanya asks, if one has done cord blood cells, can they still do adult stem cells? If yes, how much time duration in between treatments? So we've had a lot of patients who have taken cord blood cells and not improved. We've had people who've done it in the Americas. We've had people who've done it elsewhere. The duration needs to be 3 months between two treatments. So if you've had cord cells, we suggest you wait for 3 months. But after 3 months, we can do adult stem cells. So the gap between cord blood cells and adult cells is 3 months. From me to my son, Rishit, has undergone 3 since the last 3 years. He's not toilet trained, no speech, little improved. Please do suggest what to do next. So, Amit, you need to, because you'll have to, if you could just write to us, when we'll be able to speak, because we'll have to actually run through your reports and try to understand, what is happening, what the improvements are, and how much rehab has been taken. So what we find is that, kids who go back and do not do rehab in those, like, for example, if you take stem cells but do not do speech therapy, then obviously speech will, may not necessarily come. So we will have to know what rehab has happened, and we need to understand what medication he's on, and then we may be able to answer your questions a little better. Then Ajay Masan says, whenever we ask a doctor, OT person, they clearly say no for SCT. So Ajay, the thing is that the awareness of stem cell therapy is still restricted amongst medical professionals. And the surprising thing, I know this is very interesting, the same therapists who actually say no to stem cell therapy to their patients, when their relatives have a problem, they send their relatives to us. So that is, I consider that funny that you tell patients don't take SCT, but you send me your relatives. So there are conflicting views. It's got to, it's multi, and that's a topic all by itself, because you have to understand that there is an entire industry there that actually functions based on the fact that these special needs children don't improve. Because they don't improve, they need continuous therapy, they need continuous, various treatments. And once they improve, over a period of time, they will stop taking some of these therapies. So they have a fear that once patients improve, they will stop taking therapies. And so they don't recommend it. What we tell them is, actually, after stem cell, they will still need therapies. So they have a fear. And, we've had a couple of therapists. When I asked them, why do you do this? They say that, well, if you make all the patients okay, who will come to us? But that's a separate topic by itself. My pediatrician saw another anonymous, my pediatrician said that the therapy should be given at the earliest possible, like before age of 3 or 4, which doesn't lead to fruitful results. This is true. My daughter's 5 years. No, it is correct that if you give it at 3 to 4, you get better results. But if you give it before 10 years, you still get very good results. So the answer to your question is, at 5 years is a very good time. All children, where it is done before 10 years, they have very good results. So the answer to your question is that at 5 years, the results are good. Then anonymous attendee says, my son is 4 years old. I can see a video of older children. Shall I wait for 2 more years? I'm doing biomedical. So when shall I stop if I have to go for stem cell? My last question, what is the negative part of stem cell? I have heard of a child who died due to heart attack after doing stem cell in 2008. The boy was having seizures. Sorry for asking this question online, but was curious to get the answer. So first is that we showed videos. I mean, those were little older children, but at 4 years is a very, very good time. In fact, we have several videos of younger children. I didn't show them. So I would say that 4 years is a good time. You should not wait, because the longer we wait, the more are the chances of having lesser improvements. So 4 years is a good time. The next question is, you're doing biomedical. So when should you stop? Now, you do not have to stop biomedical. You can continue your biomedical till you come to us, and you can continue your biomedical even after. All right. So you don't have to stop it. Then you ask about a child who had a heart attack after doing stem cell in 2008. So now this is something I'm not aware of. The next thing, the boy was having seizures. So yes, seizures, like I told you, 3% of the people could possibly have seizers. But, heart attack is something which, children don't have. So unless there was some other condition, I don't know where this was done. I don't know how many days after the stem cell it was done. Where was the stem cell done? What type of stem cells were used? Were they adult stem cells or were they umbilical cord stem cells? How were they given? What was the gap? Was there any cardiac condition? So it's difficult to know, but we've not had anybody have a heart attack after stem cells. We've not had that. So, I'm unable to answer your question. Is SCT required in every case of autism? No. Vikas Rawat says, is SCT required in every case of autism? The answer is no. In very mild cases, you can have improvement from just therapy. So in mild autism, it is not required. But in moderate to severe autism, it is required. Then Sania says, what is the reasoning behind showing regression, new negative behaviors, losing some skills 3 to 4 months right after stem cells before showing any improvement? So we do not have regression. We've never had regression, but yes, for first 3 to 2 months, the children become, their behavior changes. That's because when the stem cells go and start improving the brain, the children become a little more aware. Their functioning improves. So for example, to just give you an example, let's say earlier you gave the child an apple or an orange and the child liked both. Okay. So you believe the child likes both apple and oranges. Now when with stem cells, as his discrimination improves, he may start liking apples more than oranges. But you still believe that he likes both. So you give him both. And when you give him apples, the child is happy. When you give oranges, now the child may get hyper and not like it. I'm just using a very crude, simple example to say that when there is improvement in the brain, the child starts making distinctions. But you are still treating the child like before. And so the child responds. So what you consider as negative is actually the brain function improving. So it's not a regression. It is the child getting a little more hyper. So it does in some kids for the first 2 or 3 months, there may be changes in behavior, but this all settles. Ganesh Kumar asked, my son is 7 years old and he's in a minor end of the spectrum. Does this therapy help in improving his social skills with his peers and hyperactivity? Yes, Ganesh, it will definitely help with social skills. We find all our kids' social skills improve and hyperactivity also improves. Ajay Masad asks, if autism is genetic, then SCT works. Yes, because we are not, first, autism is not genetic always. They have found some genes which can affect it, but the causes of autism are so much, from birth defects to, from problems during the birth process to, heavy metals and so many other things. So, but again, stem cell therapy does not correct the genetic defect. It repairs the damage caused by the genetic effect. So what we are doing, I showed you on the PET scans, there is damage in the brain. Our child is symptomatic because of the damage. We correct that damage. Harish Babu says, do you have a branch in Hyderabad? No, we do not have a branch in Hyderabad. We do not treat in Hyderabad. But we do have once a month an outpatient where my colleague, Dr. Nandini, comes and patients can be seen there. But during the pandemic, we have not been doing that. Otherwise, once a month, our team of doctors comes to Hyderabad for evaluation of patients. Sandeep Kapala asks, how beneficial for my kid 3.5 years having ASD? Any chance of regression again? No, at 3.5 years, the chances are very good. They are excellent. I would strongly recommend you do it. There is no chance of regression again. The only time we've had a few kids who had regression was if they have very high fever. So kids who have improved, but not normal cold cough fever, like, malaria, dengue kind of very high fever. So a couple of kids who had that had some regression. But apart from that, there is no chance of regression. If the kid having autism through genetics, will it work? Will it repair the mitochondria also? So it does not repair the genetic defect, but yes, it does repair the mitochondria in the damaged brain. I'm repeating again. Stem cell therapy repairs the damage in the brain. Okay. It also repairs things that are happening intracellularly, including the mitochondria. Harish Babu asks, can the kid support while having PET scan, MRI? Yes, because when we do PET scan, MRI, we give a sedation, general sedation, short-acting anesthetic, so the child can go through it very comfortably. Sania asks, does success of SCT or any response of body to SCT depend on gut biome condition? So we have not seen, although part of our protocol, we have a gut cleansing. We give per rectal ozone for gut cleansing. But we have not seen any connection. In fact, we have seen that after we repair the brain, a lot of the gut issues, actually clear up as well. Apart from the behavioral issues, a lot of parents report that their gut issues also clear up. So the response does not depend on the gut biome condition. Somebody called OPPOF11 Pro says, my child has been diagnosed with hydrocephalus from birth. Will it be of use for him? He's 19. No. Stem cell therapy does not help with hydrocephalus. Hydrocephalus is an increased collection of water in the brain, and stem cell does not reduce the increased collection of the brain. So hydrocephalus has to be treated by something called a VP shunt. You have to do a shunt, or it can be treated endoscopically through what is called third ventriculostomy. Stem cells won't help in that. However, if the brain has some damage, and if the brain has certain issues and the child has neurological issues, we could possibly correct the brain damage caused by hydrocephalus, but not the hydrocephalus. Sandeep Kapala again asked, every child with autism requires stem cell therapy. So I answered that again. Very mild symptoms they don't require. Those who respond well to rehabilitation don't require. But most moderate and severe children will require stem cell therapy. Gaurav Singh asks, how long will the rehabilitation program have to go on for 2 years child after stem cell therapy? So the rehab program goes on for roughly for about 2 years or so till after the stem cells. And gradually it diminishes. So first you may require speech therapy, occupational therapy, behavioral therapy. Gradually things as improvements come, we slowly diminish it. But you need to continue for about 2 years or so. Anonymous entity says, how many sittings required for stem cell therapy? I've seen a few parents who have done stem cell therapy for kids below 5, but they don't see much gains. How many sessions, it depends on the amount of damage. So if the damage is mild, then it requires mild to moderate. It's a single session. If it's moderate to severe, they may require more than one session. Now, we have, in our experience, we have never seen a child below 5 who has not improved. Okay. Now, all children show improvement, but the improvements may not be as much as we expect. And most important, if you do not do rehabilitation after stem cell as we advise, you will not see improvements. Okay, so like I told you, if the brain is like a computer's got hardware and software. Stem cell therapy corrects the hardware only, it does not put software. So if you have a laptop and the hard disk or the motherboard is damaged, and I'm an engineer, I can fix your hardware and give it to you. But if you don't put software, you cannot say that I didn't repair the hardware properly. So I repeat, stem cell requires rehab. So many parents don't do rehab and then they don't see improvements. Okay. So you have to do rehab afterwards. Then can homeopathy medicine be taken along with stem cell therapy? Yes, you can take homeopathy medicine. We have no problem with it. Gaurav Singh says, can stem cells be repeated if the child shows improvement, or can it be only done once? So Gaurav, we can repeat the stem cells again. There's no problem. We can repeat it. Harish Babu says, how many times we need to visit? We need minimum 2 visits. So you come once, we do the stem cells. After 6 months, you have to visit for us to do the repeat PET scan. Because you want to see the damage, right? The first time you come to us, Harish, you will see all that blue brain damage. We want to show you after 6 months that the damage is gone. All right. So again, to that, there was an earlier question that, that they don't have much gain. So what we have seen is that on the PET scan, there are improvements. But if the child does not improve, it means that the rehabilitation has not been done. So to come back to your question, how many times you need to visit? Harish, you need to visit twice. Gaurav asked, how long does it take for the child to get his speech after stem cell therapy? It can take a year, even 2 years. So it takes 1 to 2 years to get back speech, Gaurav. Sania says, I've seen one known kid of NeuroGen for 3 years treatment, saw drastic change in his head shape as well. Does HCD help in plakocephaly too, or was it just age? No, it does help. So we have seen that after stem cell, there are changes in the head shape, because as the brain starts, so our treatment does not work directly on the plakocephaly, but as the brain starts improving in function, as the brain gets stimulated, it does cause, we have noticed that there are changes in the head shape. So the head shape improvement comes as secondary to the brain improvement. So Sangamitra Prabhu says, will speech improve after SCT in a 13-year-old kid? Yes, speech will improve, but 13 years, you're crossed the best time. So, the results will be lesser than that in a younger kid. But yes, speech will improve. It will take a little longer time, Sangamitra, because your child is already 13 years old. Gaurav Kodesia says, why stem cells are only on Tuesday? Does it increase the number of patients? Does it not increase the number of patients on one particular day? No, we do it because we have a system, and there is a certain protocol that is followed. There is rehabilitation, and then there are integrative therapies, and all are done in a particular sequence. And because everything is done in a particular sequence and we have a limit to the number of beds, we can't have more than a certain number. We find this way better because then all the patients get identical therapies on the same day. Earlier, we used to do it on different days, and we found that that was affecting the overall function and even the results, because there was, different children were doing different things. So we were doing it till about, I think 5 years ago, we were doing it on different days, 3 times a week. And we find that this is better from the patient's point of view. What is the advantage of intrathecal over intravenous? Now this, Sania, is a very intelligent and a good question. See, when we inject intrathecally, and I want all the parents to listen to this carefully, we are injecting directly into the spinal fluid and it goes straight to the brain. Within minutes, it is in the brain. When you give intravenous injection, you inject intravenously like into the hand or something, and from there it goes to the heart first, the right side of the heart. From the right side of the heart, it goes to the lungs. And 70% of the cells stay in the lungs, 70%. Only 30% of the cells leave the lungs and reach the brain. Also in the brain, there is the blood-brain barrier, which can sometimes prevent the cells from going in. So 100% of our cells go directly to the brain when we do it intrathecal. Whereas in intravenous, 70% get taken up by the lungs and only 30% reach the brain. So that is why we prefer intrathecal over intravenous. So intravenous is useful in other things, but not for brain problems. Harish Babu says, is toilet awareness will improve? Currently, he doesn't know anything about toilet and does wherever he is at home. Yes, toilet awareness improves significantly and dramatically. In fact, I had some videos which I didn't show. We had some children where the parents actually talk about this. So toilet training improves very much significantly. Neera Mittal says, how will you check the damage is mild? Well, we will, when you come here, we evaluate clinically all our departments, our occupational therapy, speech therapy, psychologists, doctors, we all evaluate. We do scans, we do a PET scan, MRI, EEG. We have a very detailed evaluation process. And based on that, we decide whether the damage is mild. Sandeep Kapala, is insurance coverage cashless? So we have tie-ups with several insurance companies. So there are some insurance companies that do give coverage, not all. Some give full, some give partial. There are some companies that have introduced now a partial, a 50% co-pay policy. So you have to pay 50%, insurance give 50%, and some insurance companies don't cover at all. So yes, we will help you and guide you. So the answer to your question is 1/3 of the companies give, 1/3 give 50%, and about 1/3 of the companies don't give. So it depends on which company you have insurance from. Harish Babu, when we do SCD in Mumbai and come back to Hyderabad, can we have rehab from an institute or we need to find our own? So no, you will have to find your own rehab. But we are in the process right now of setting up a digital rehab system. We are starting with speech therapy and then we'll go on to other things. So I think in another 3 months that will go live. And we are going to have a program where we will continue our rehab digitally. So you can have you can do your rehab comfortably from home. But that is in the process of preparation. It's not ready yet. And hopefully before the end of this year, we will be able to offer you digital rehab, virtual rehab from our institute. Anonymous attendee says, doctor, as my first question, he said I can continue biomedical after stem cell and then do stem cell. I should stick to one. I'm confused. What is the difference between biomedical and stem cell treatment and progress? Do mention. See, biomedical is a completely different way of treating. Biomedical, in stem cells, we are actually putting cells into the body. Biomedical is not like that. There are things are being given orally, and there are 2 completely different systems of treating the patients. And according to us, both complement each other. So there is no reason. Your question, should you stick to one? No, if you saw my presentation, I told you there is no one silver bullet to autism. It requires multiple things. So if you say, should I just stick to rehab, for example, or should I just stick to homeopathy? My answer is whatever you're doing, continue it. And stem cell therapy will be in addition to that, and it will mention. So you can do both. Amit Jalan says, does he see improvement only after 1 to 2 years after completing 3 shots, or is it a continuous process of improvement? So the process of improvement is continuous, Amit, because we have been doing this for the last 10 years, 13 years actually, since 2008. And our parents, the children we treated 10 years ago, they are still having a sustained progress or improvement. So the improvement is continuous. It is not improvement that stops after 1 to 2 years. Then Ajay Masad says, do we expect some changes while taking discharge after 3 days? Not really. You're unlikely to see any improvements in 3 days. You will see some, but nothing major or dramatic. Neera Mehta says, please mention the insurance companies. Well, Neera, I suggest that you email us and we will send you a list of which insurance companies give coverage and which don't. The email is on the screen. You're welcome to email us. We will send you the details. Sania, what is the expansion of stem cells they talk about? Are stem cells expanded in your procedure? No, we do not expand stem cells. Those people there are some people who take the stem cells, they expand them and they grow them, but that requires adding of chemicals. And we do not believe in artificial chemicals. We believe in natural stem cells. We take the stem cells as they are and put them. And our research, we did 10 years of research before we started doing clinical stem cell work. And we find that the expansion naturally in the body is better than the expansion artificially outside. So we believe in putting it in the body and letting the body expand. We do not expand from the outside. Amit says, thanks. Thank you, Amit. Harish Babu says, we have stored our first kid stem cells at LifeCell, and can we use this for my second kid? No, Harish, the stem cells of your second, the stem cells of your first kid can only be used for your first kid. They cannot be used for your second kid who has the problem. Ajay Masan says, thanks, Dr. Alok, for answering each and every question. The pleasure is mine. And just to let you know that should any of you, I'm repeating, any of you, again, Neera says, thanks for answering all the questions. But this is a general thing. All of you who want to ask me more questions, please, the number on the screen, send us a WhatsApp, and we will set up a virtual free of cost consultation where we can discuss your child specifically. And, we can have a video consult and I'll be able to advise you better. Since there are no more questions, I'm going to end this session. I want to thank all of you for being with us patiently. There were a lot of people who attended. Thank you for your attention. Good night and goodbye.